Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear an interview with Sarah, a pharmacist, discussing how to choose medications for conjunctivitis, pink eye. You now have 90 seconds to read questions 31 to 36.
Good morning, Pharmacist Sarah. Thank you for joining us today. Can you tell us about the process of selecting the right medications for patients with conjunctivitis?
Good morning. Of course. When choosing a medication for conjunctivitis or pink eye, we first need to determine the type of conjunctivitis the patient has. It could be bacterial, viral, or allergic.
How does the type of conjunctivitis affect the choice of medication?
If it's bacterial, we typically prescribe antibiotic eye drops. For viral conjunctivitis, there isn't a specific treatment, so we usually recommend lubricating eye drops and advise patients to maintain good hygiene. If it's allergic conjunctivitis, antihistamine eye drops can help relieve symptoms.
Are there any over-the-counter options that can be effective?
Yes, for mild cases, over-the-counter lubricating eye drops can help soothe irritation. However, it's important for patients to consult a healthcare professional to ensure they're using the right treatment.
What should patients be aware of when using eye drops for conjunctivitis?
Patients should be careful to follow the dosage instructions and avoid touching the dropper tip to the eye or any surface to prevent contamination. They should also discard the drops after the prescribed period, even if there is some left.
Thank you, Pharmacist Sarah. That's very helpful information.
Now look at Extract 2. Extract 2. Questions 37 to 42. You hear a presentation by Dr. Michael, an ophthalmologist, discussing dry eyes in office workers and treatment options. You now have 90 seconds to read questions 37 to 42.
Good afternoon, everyone. Today, I'm going to talk about a common issue among office workers, dry eyes. This condition occurs when the eyes don't produce enough tears or when the tears evaporate too quickly.
What are the main causes of dry eyes in office workers?
The main causes include prolonged screen time, air conditioning, and not blinking enough. These factors can reduce tear production and lead to discomfort.
How can office workers manage or prevent dry eyes?
The first step is to take regular breaks from the screen. The 20 to 20-20 rule is useful every 20 minutes. Look at something 20 feet away for 20 seconds. Additionally, using lubricating eye drops can help keep the eyes moist.
Are there any environmental changes that can help reduce dry eyes?
Yes, increasing humidity in the workspace and avoiding direct air from fans or air conditioning can be beneficial. It's also important to position the screen below eye level to reduce strain.
What treatments are available for those with chronic dry eyes?
For chronic dry eyes, we may recommend prescription eye drops or other treatments like punctal plugs, which help retain moisture in the eyes. It's essential to consult an eye care professional for proper management.
Thank you, Dr. Michael. That's very informative.
That is the end of Part C.
AVN Pharma Education.